Madam President, late in the day on Friday, after reporters had gone for the weekend, the Obama administration quietly released its new Medicare Advantage payment cuts. The cuts President Obama wants to make to this program, I believe, as a doctor, are potentially devastating to millions of Americans. The next morning, the New York Times headline was, U.S. proposes cuts to rates in payments for Medicare. Politico wrote about it too. They said the Obama administration is proposing a major cut in 2015 payments for Medicare Advantage. 15 million Americans, Madam President, depend on these health insurance plans that the President wants to cut. But instead of listening to seniors and investing in a program that works very well, the Obama administration is doing everything conceivable to make sure that Medicare Advantage fails. Back in December, the press gave President Obama the Lie of the Year award for his statement that if you like your health care plan, as he said, you can keep it. Well, millions of people across America have now gotten letters saying that their insurance plans were being canceled because of the Democrats' health care law. By cutting Medicare Advantage, I will tell you, the Obama administration is now ensuring that even more Americans can't keep the health care plan that they like. 29% of all Medicare patients have chosen to enroll in Medicare Advantage. There's a reason for that. The Medicare Advantage program lives up to its name by delivering clear advantages. The plans give extra benefits like dental coverage, vision coverage, hearing benefits, wellness programs, things that are important to our seniors. Sometimes they offer smaller co-payments, lower deductibles, less out-of-pocket costs than the traditional Medicare program does. Sometimes seniors even pay a higher monthly premium for these extra benefits, but often the benefits are financed through plan savings due to the programs and the way they work. For many seniors, Medicare Advantage is a good option. It is the right option for them. These are people who don't have a lot of money, but who still want the peace of mind that comes with good health insurance. Those seniors are now facing much higher costs or lower benefits because of the Obama administration decisions rolled out last Friday night. Because of this proposal and the administration's way to try to sneak it out on Friday, seniors are concerned and they're anxious about what the administration also is hiding. Ever since the President and Democrats in Congress passed their health care law, they've been going after seniors who rely on Medicare. They raided a total of over $700 billion from Medicare, and we discussed that during the debate over the health care law. The money was taken from seniors on Medicare, not to strengthen Medicare, not to secure the future of Medicare, but to start a whole new government program for other people. There's a whole new bureaucracy, and it's been created by Washington Democrats in the health care law. Now, Obamacare specifically targeted the Medicare Advantage program. Significant amounts of direct and indirect cuts, payment cuts, totaling over $300 billion. That's 43% of the total Medicare cuts just for this one program. So 29% of Americans, the seniors relying on Medicare Advantage, because about 29% of seniors on Medicare are in Medicare Advantage, well, they're responsible for 43% of the cuts. Because of these cuts and other changes in the law, fewer private health care plans are going to be able to participate in Medicare Advantage in the future. That means a number of things. It means that some people who rely on these plans are going to find out that their plan is being canceled entirely. And some people in Iowa, thousands of people in Iowa, have already gotten letters canceling their Medicare Advantage plan. The Kaiser Family Foundation looked at what the President's health care law does to seniors, and they say that about 500,000 patients will lose their existing coverage, seniors on Medicare Advantage. These seniors are going to have fewer options to get the care they need from the doctor that they choose at lower cost. Now, more of these people are going to be forced into a one-size-fits-all government plan. They're going to lose the insurance that they had, insurance that they liked, insurance that worked for them. Some people may find that their new insurance network doesn't include the doctors that they had before. We've seen this happening all across the country as the major provider of Medicare Advantage said to try to make it all work, they had to eliminate many, many doctors from their their plans so that those doctors are not going to be able to keep their patients, and those patients are not going to be able to keep their doctors, in spite of what the President told the American people when he looked into the camera and said, if you like your doctor, you can keep your doctor. A lot of these people are going to see their costs increase. The Kaiser Family Foundation says that the average out-of-pocket limit for Medicare Advantage plans is going to increase by $464 this year. The President and Washington Democrats say that their health care plan was going to save people money. Save people money. That's what the President told the country. That's why he said he did this whole health care law. He said it was going to save people money. That's what people wanted. The President told people what they wanted to hear, but he failed to give them what he promised. That's why his credibility ratings are down. That's why people believe that he has misled them intentionally. And that's why this administration has viewed to be incompetent by a majority of Americans. Turns out costs continue to go up because of the law. This new round of cuts to Medicare Advantage is just another example of how the health care law is wrecking our health care system, not fixing it. America's health care system wasn't working before, but the President and the law that Democrats voted for has made it worse. Medicare is headed toward bankruptcy, but the administration has rejected bipartisan solutions to reform and to strengthen the program. Through cuts like the ones announced last Friday, the President's health care law takes money from Medicare and uses it to pay for something else. Now, there was actually a double data dump that occurred on Friday. The Medicare Advantage cuts were announced late in the day, and then later than that, the CMS, the Medicare Medicaid services for the country, they came out with their report, and it reported that 2/3 of small businesses that provide health insurance for their employees would see their prices go up because of the health care law. 2/3 of small businesses. These are ones that by law don't have to provide health insurance. The employees less than 50, they don't have to by law supply, but they do often do that. They do supply that insurance. I think about 17 million people get insurance that way through work, businesses that are not mandated to supply the insurance, but they do to get good to get good workers. And as a result, what they're seeing is that their rates are going up. So that was part of the double data dump that occurred on Friday. Now, it was interesting, Madam President, to see a note that came out of the Democrats' lunch meeting today. It was just reported in Roll Call magazine. It said a group of Senate Democrats is expected to launch a counteroffensive in favor of Obamacare on Wednesday, a response to persistent attacks on the law from their Republican counterparts. Well, first, I would point out the attacks on the law are coming from American citizens all around the country. It's what we hear at town hall meetings. It's what we hear as we travel around the country. People whose families are noting they're paying more, getting less, losing their doctors, losing their insurance. But the report from in Roll Call says that Democrats discussed the new endeavor, touting benefits of the Affordable Care Act during Tuesday's weekly caucus lunch to a warm reception, according to Connecticut's Christopher S. Murphy, who is one of the senators leading the effort. Senate Democrat aide said the formal rollout will come Wednesday. Well, I welcome an opportunity to hear what the Democrats have to say, because it is the damage being done by this health care law to people all across the country is significant. And it's interesting. All you need to do is turn to the Friday's New York Times. Robert Pear, an excellent writer for the Times, had I thought a fascinating story. Took 2 pages of the paper. Public sector capping part-time hours. Public sector, Madam President, capping part-time hours. Why? Right here in the headline, to skirt health care law. Well, let me start. Cities, counties, public schools, and community colleges around the country. We're not talking about businesses here. We're not talking about fast food chains. We're talking about cities, counties, public schools, and community colleges around the country have limited or reduced the hours, the work hours of part-time employees. Why? To avoid having to provide them with health insurance under the Affordable Care Act, state and local officials say. The cuts to public sector employment, which has failed to rebound since the recession, it says here, right here, could serve as a powerful political weapon for Republican critics of the health care law who claim that it is creating a drain on the economy. Well, it is creating a drain on the economy, Madam President. When you have two folks here in the picture in Medina, Ohio, working on a trash truck. One of the gentlemen talks about his hours being limited to 29 hours. He called it a hit to his wallet. The president is fighting to talk about a minimum wage, but actually people are losing take-home pay. It is impacting their wages, the health care law is. It is impacting on how much money they take home at the end of the week. When you can go over to the rest of the page, to the next page, that talks somebody who works as a clerk in the Parks Department saw her hours drop from 38 a week to 35 and then to 29. Why? Because of the health care law and the 30-hour limit. And it's interesting to go through the list of the different jobs of people that are losing hours, who want to work. These are hard-working Americans who are having their hours cut. Public sector workers, people who work for cities, counties, public schools, community colleges. The list goes on. Police dispatchers, prison guards, substitute teachers, bus drivers, athletic coaches, school custodians, cafeteria workers, and part-time professors, office clerks, sanitation workers, park inspectors, all in all, people that are being hurt because of the president's health care law and the mandates and the way that it is put together by this president and the Democrats that voted for it. And it's interesting to see the senator from Connecticut mentioned here as leading the effort, and I would recommend to him this article by Robert Pear in Friday's New York Times, who goes specifically to the core of what's happening in Connecticut, in that senator's home state. It says, Mark Benigni, the superintendent of schools in Meriden, Connecticut, superintendent of schools in Meriden, Connecticut, this is a public school, public sector, says, and a board member of the American Association of School Administrators, said in an interview that the new health care law, he said, is having, quote, unintended consequences for school systems across the nation. This health care law is full, Madam President, of unintended consequences. And now we have someone who is a board member for the American Association of School Administrators saying that the health care law is having unintended consequences for school systems across the nation. And he specifically says, in Connecticut, as in many states, this is the article now, in Connecticut, as in many states, significant numbers of part-time school employees work more than 30 hours a week and do not receive health benefits. Now, quoting the superintendent of schools in Meriden, Connecticut, he says, are we supposed to lay off full-time teachers? Are we supposed to lay off full-time teachers so that we can provide insurance coverage to part-time employees? The superintendent goes on to say, if I had to cut 5 reading teachers to pay for health benefits for substitute teachers, he said, I am not sure that would be best for our students. So, Madam President, I'd ask the President of the United States, what do you want? These are the choices that, because of your health care law, crammed down the throats of the American people, you are asking the public sector of our country to make. Get rid of 5 reading teachers in Meriden, Connecticut, to pay for expensive health insurance policies for substitute teachers that superintendent is trying to say, I'm not sure that what the law requires would be best for our students. I think this law was not well thought out, was not well planned, so I'll be interested tomorrow to see Senate Democrats come to the floor with their Obamacare PR counteroffensive and explain to the American people why the American people are being faced with a website with a disastrous rollout 4 days after the president told the American people it will be easier to use than Amazon and cheaper than your cell phone bill, and you can keep your doctor if you like your doctor. Why 5 million people then got letters from insurance companies saying their insurance policies have been canceled. Why the website failure is just the tip of the iceberg that the American people are seeing right now in terms of premiums going up, canceled policies, can't keep their doctor, higher out-of-pocket costs, higher copays, higher deductibles, all in spite of the President's glowing promises, which, in my opinion, were made to deceive the American people in an effort to pass a health care law which many people see as bad for patients, bad for providers, and bad for the taxpayers. So I'm going to continue to come to the floor and talk about what I hear as I go home to Wyoming each week in terms of a health care law which is not providing the patients what they asked for, what they need, and what they were promised. Thank you, Madam President. I yield the floor.